we had a few specific questions about the way the nervous system interacts with symptoms and whether if you experience vulvovaginal pain or itching, it might be a nervous system issue. Especially the itching one's an interesting one because we think of nerves and pain, but not necessarily itching. Do you have thoughts to share on that?
Yeah, so it's a tricky one, isn't it? Because there may be a bacterial or fungal
Mm-hmm.
presentation causing that as well. And certainly with clients who have come to me saying they have vulvodynia and they've been given a vulvodynia diagnosis, we then go and use next generation sequencing testing and we find either a bacterial or fungal or both overgrowth
Mm.
going on in the vagina. And once we resolve that, the vulvodynia symptoms die down or go away completely. So is it nerve? Is it bacterial, fungal? What's going on there? It's unpicking all of that, and it's never going to be a set thing for each person. But yes, definitely, I think, going back to that nerve sprouting, you mentioned about the endometriosis as well. We're understanding more and more and more where there can just be more additional nerve sprouting happening.
Mm-hmm.
So I think, we need to think about, is that something that's going on? And again, that then comes back to the brain and how it's perceiving that pain and the volume button that's being turned up on it. So there are obviously other nerves in the area. I'm not going to go into like the pudendal nerve and things like that because I'm not a pelvic floor specialist and this
Mm-hmm.
isn't quite my area. But there are specific nerves that run through our pelvic bowl and they can either get trapped or they can become oversensitive. I mean, most of my clients I refer back out to see pelvic floor specialists
Mm-hmm.
because quite often, even just when you're in pain, if you think about it, when there's pain, you're going to tighten up. You kind of, everything gets a little bit tighter. Um, and that in itself can cause specific parts of the pelvic floor to tighten up. So quite often, some people might just have one part that is tight.
Mm-hmm.
I had one client where her UTI symptoms um, seemed a little bit, she actually came to me very early on in her journey, and her symptoms seemed a little bit kind of not unusual, but they didn't quite fit the mold, as everybody's don't really, but hers
Mm-hmm.
specifically didn't. And I recommend, because of other things that she'd said as well, like pain with sex and things like that, I referred her out to a pelvic floor specialist. She then also happened to have urethral a cystoscopy, and they did urethral dilation because they said it was too tight around there.
Mm-hmm.
And then the pelvic floor specialist said that she did have a hypertonic pelvic floor. And actually, as she worked on all of that, her UTI symptoms decreased. So
Mm-hmm.
maybe it was just urinary retention in the first place that was causing bacteria to stay pooled in the
Mm-hmm.
bladder that was causing the problem. There's so much wrapped up in it. It's such a complicated, massive things going on down there.